Hi, my name is Dr. William Ravekes. I'm an Associate Professor of Pediatrics in the Division of Pediatric Cardiology at the Johns Hopkins Children's Center. One of my areas of clinical work is non-invasive imaging, especially echocardiography. So it's looking at kids' hearts when they first come in to see if there's any problem, what might be going on. One aspect of that is also doing fetal echocardiography, which I find just amazing and fascinating because we're looking at a baby's heart before it's born. We're seeing these babies at 18 weeks gestation, 20 weeks gestation along, and though I understand all the science and how it works, I also like the almost magic component of how we can do that and look at a baby's heart well before the baby's born, try to help out the moms, the dads, the family to know what's going on. We do similar imaging for kids afterward in clinic. Another aspect of what I do here that I really like for my clinical care is helping out children with heart failure and heart transplants. It's an incredible and amazing experience to take somebody who's got the worst heart function, who might need an artificial heart pump to help them stay alive, and then when we get an appropriate donor, and I always want to respect the donor families and the amazing gift that they give, that we can do a heart transplant. Our surgeons do these incredible jobs and these kids come out and they've got normal hearts. And now they have normal heart function. And now they can do things they never were able to do before. They're running, they're playing. There's the Heart Transplant Olympics. They can go in and compete in swimming and jumping and track and field and everything else. My specialty is pediatric cardiology. It's taking care of children who have problems with their heart. Sometimes it's actually they don't have a problem with their heart, which is great. They'll come to the clinic, we'll take a listen, we'll examine them, we might do some testing like an echocardiogram, and we find it's an innocent noise, an innocent murmur, and their heart's totally fine. That's great. Other times, unfortunately, the children do have heart problems. Sometimes they're problems they were born with, a hole in the heart, a valve that doesn't work right. Sometimes they can be completely missing a chamber of the heart. The kids are amazing. Nowadays, we have surgeries that we can do to repair almost all heart defects, and the strength these kids show, their families show, it's fantastic. So I do collaborative research with pediatric cardiologists around the country and around the world. We at Hopkins are part of the Pediatric Heart Transplant Society. We're part of other societies. So it's collaborative research. How do our patients do? How are patients at other hospitals being treated? Which medicine is the best? How should we address this? So that's where the majority of my research is. I also do collaborative research on children who have what are called aortopathies, problems with their aorta, the biggest blood vessel leaving the heart. It can happen in adults certainly, but it can happen in children. One thing I want to say about Johns Hopkins in general that I really value is that Johns Hopkins has what's called the Miller-Colson Academy of Clinical Excellence. They truly value clinical excellence and putting the patient first. And to brag a little bit, I made it into that academy a couple years ago, and it's something, again, though, that I find is great about Hopkins. But my philosophy of patient care is that it is about the patient. Part of that, I think, is time. You really have to spend time with the family and time with the parents to ask the second questions, and more importantly, to be quiet, to listen, to wait for that teenager doesn't really want to tell me what's going on. But if you take the time, if you allow them to tell their story, what they're feeling at their pace, I think that's an incredibly important part of patient care.